Hello YouTube, this is Kitty Clinical here with another video, and today we're going to be doing something very brief on Tylenol and liver cirrhosis. Now, there's a big misconception out there, especially when I was an intern on nights. The upper year that I had basically said that you should not give Tylenol to patients with liver cirrhosis. It's contraindicated. And while that may be true to some extent, not really. So I'm going to go through in at some bit of length about why this is not the case, why it's okay to give Tylenol to patients with liver cirrhosis, but you don't want to do it in a large amount, right? You don't want to give someone the same amount of Tylenol who has liver cirrhosis as somebody who doesn't have liver cirrhosis. So what you should do is you should limit it to like 1 to 2 grams a day of Tylenol. They can tolerate 1 to 2 grams of Tylenol in a 24-hour period. This is good to know if you're on nights or you're on hospitalist medicine and you're treating somebody with liver cirrhosis. You should know that it's okay for them to get a little bit of Tylenol, especially if they really need it. But don't go overboard. I would not go over 2 grams of Tylenol. What you want to avoid, actually, are the NSAIDs, such as ibuprofen. Why? Well, as many of you know, Tylenol goes to the liver, ibuprofen goes to the kidneys. And if you give somebody with liver cirrhosis a nephrotoxic agent, then you run the risk of what we call hepatorenal syndrome. Now, if you don't know what hepatorenal syndrome is, that's outside the scope of this video, but it is something that I recommend you read up on. It's good to know for your boards. It's good to know in general. But the gist of it is that you've shot the liver already. If you're going to shoot the kidneys, then you're screwed. Okay? So that is the gist of that topic. You want to allow them to have a little bit of Tylenol. It's okay, but don't go overboard. And then what you want to avoid, contrary to popular belief, contrary to what most people think, you want to avoid giving patients with liver cirrhosis NSAIDs. So, hope you find this gem interesting or amusing or helpful. Hope you can use it in your practice. Let me know in the comments below if you disagree or agree. This is actually a topic that I learned while studying for the boards. It's something that I still remember to this day. I'm sure that by the time you watch this video, maybe the guidelines have changed, but this is what I know, at least in the year 2023. So anyway, take it easy, everyone. Have a good day.